Imagine for a moment that you're 10 years old.
And suddenly, you can't live at home anymore because it's not safe. It's not where a child should be.
You might have been abused or neglected, and now your mom isn't there for you, or your dad.
And just like that, your world changes forever.
So what happens now?
For the next 8 years, you live in a new sort of home.
It's called being placed. It's different, yes, but it is a home.
You're given shelter and food to eat.
You receive medical care and some financial support.
Caring people look out for you, offering friendship and guidance.
All this support is provided by a government-run system.
All you know is that you're learning to trust again.
You're trying to make the best of it.
And then, on your 18th birthday, this could all be taken away from you.
Things seem to be changing so fast.
You leave the safety of the place that's been your home when you needed one the most.
You have no means of support, no bank account, no health insurance.
And most importantly, no one to guide you into adulthood.
At the age of 18, you remember how you felt when you were 10.
Suddenly, you're alone again with all the challenges that accompany this pivotal point in your life.
Because now you're out of foster care.
Now you're on your own.
The Department of Social Services, of course, has around 300 youth in care in any one year. And so for years we've tried to do our best, and this is true nationally as well as in North Carolina, to do our best to support these youth through age 18. There's a variety of programs and services that accomplish that and try to accomplish that. But the truth is, after age 18, either as a nation or as a state, there has not been a defined set of services that allow them to transition in a successful way to adulthood. Well, let's talk for a second about what happens to these youth, because you've got to remember these foster youth come to us after having suffered, some of them, not all of them, some of them suffering life's most horrible challenges at a very young age. Some of them are sexually abused, some of them are physically abused, some of them have no parents, and some of them do not have parents to return to. So when we then assume the responsibility of taking care of them, that in itself is traumatic for them. And so it isn't only just a resource problem, it's a problem of having these youth believe that somebody believes in them, because they've had to go through experiences that most of them have never had to go through. These kids experience poor outcomes at a rate much higher than any other set of youth that I'm aware of. They experience homelessness, they drop out of school more quickly, they do not finish school, they do not go to college. Many of them, not all of them now, but statistically I'm talking about, they have babies at a younger age, they cannot find stable employment. The list goes on and on and on. And my contention is this problem is not a problem of resource, it's a problem of collaboration, it's a problem of clarity about how we work together to surround these youth with the best opportunities we can. Winston-Salem is a very unique community. We have a very large number of private nonprofits. We have a very large number of folks willing to be at the table. That's one of the most wonderful reasons that was something I've learned since being here. And so it is not hard to start a conversation in Winston-Salem. The actual business of getting focused and making progress is, of course, the challenge. And so that's the exciting thing, I think, about this initiative, is people are willing to work at it. The Winston-Salem Foundation, I think, is uniquely positioned to be sort of a community convener and a host. We were not looking for someone to take this issue over by itself. We're not looking to get rid of the issue. We're looking to partner with someone who can meet us halfway and can think about this issue long term and can think about how to create the kind of capacity, the kind of public will, the kind of partnerships in the corporate area and a variety of the community that would give us a chance as a community actually to do something different that would have a better chance of success.
Well, from my perspective, the very first thing was learning about the issue. I guess many people in our community really don't know a great deal about the challenges that kids have coming out of foster care. So my first exposure was visiting and meeting with the folks at the task force, which Karen and Claudette Weston actually led, and hearing about the issue.
You know, we intentionally did not want this initiative to sit within an institution that was seen as a singular institution, like DSS, so that it would be seen as DSS's problem or the school system's problem. We wanted it to be seen as the community's issue. And so we needed some place that would represent the community that didn't have an institutional legacy behind it.
Well, the first approach was Joe Raymond approaching the Winston-Salem Foundation and saying to us, this really is a community issue. And I have to admit, when I first heard this, I thought, well, we shouldn't be doing this. This is a DSS issue. But I soon learned that it truly is a community issue. The fact that at those early meetings with the task force, there were so many other community partners around the table, that again led by Karen and Claudette, opened my eyes to the fact that we need to approach this a little bit differently.
We try to solve so many big social problems that it's hard for people to get their arms around. This one is eminently solvable. We can point to the person, the number of young people we're talking about on a monthly basis or a yearly basis. It seems solvable, and it also is a way on the small level for philanthropy to really get more engaged in systems change, because what we want in the outcome is for the system to change itself in such a way that it is able to serve these young people better over time without any outside intervention. We want the system to embrace the kids themselves.
One of the most critical things for us to do is to listen to the youth. Unfortunately, many of us, and especially those of us who worked in the public health sector, we have oftentimes done things to people and not with people. We haven't made the sincere attempt to ask, what exactly are your needs? One of the things that the Casey model provided for us is that message that youth have to be equal partners at the table, and I think we've lived up to that pretty effectively.
Well, I entered care whenever I was 14 years old. I had to be removed from my home due to situations that happened within the home with my father. So I had to enter care. I was never a troublesome youth, so that was never the situation. So I would say I went to about 5 different foster care homes. Only one of them I was happy in, but still had to be removed from there. And I went to a group home as well. So just within those, I was never happy. I started to become a little troublesome at times, not really interested in my education. I just wanted to be, because I felt like I was being punished for something that I did not do, and I had no control over the situation. The Youth Leadership Board that we have started, that is basically a bunch of youth that have been in foster care, and we all come together to try to figure out the different struggles and the different situations that are the challenges for foster care system. But what the Youth Leadership Board does is whenever we meet, we come and we figure out what are the problems that's going on in foster care. How is it hard for a youth to transition easily out of foster care? So we look at those different situations and we just try to figure out ways to improve it. And then we go about the different procedures of the process of talking to whoever we need to talk to in order to improve foster care, because it really needs a lot of work.
Primarily, our mission is to create opportunities for people to enhance their lives. Typically, that's by us helping people overcome barriers to employment. But another part of our mission is also to collaborate with community organizations. So recognizing that no one organization has all of the answers in the community problems like this one are too broad for any one agency or organization to tackle on their own. You need to be collaborative. So when we saw the opportunity to be engaged in this issue, we leapt at it. This initiative is a great example of community leadership, where someone saw the need, Joe Raymond at DSS, pushed it up, found willing ears at the foundations to understand and help him take this initiative to the community and get the right people around the table, that many of which obviously were already dealing with the issue from their little slice of the pie. But by getting everyone there, getting the youth involved, hopefully we get the foster parents involved very quickly, and make this a true community issue with the right amount of publicity and awareness of the issue. The awareness itself will gather resources.
The expression, "it takes a village to raise a child," we've heard it before. It's a perfect example. The village consists of everyone. I mean, it's from the person who is walking the streets to the person who owns the local store or the local business. It takes a village to raise a child. Under the best of circumstances, these aren't the best of circumstances. The challenges for this population, they're unique challenges which can be addressed. But if ever there was the concept of a village raising a child, this is the one that it would apply to.
I would say if it takes a village, then build a village. And that's what we're doing. We're building a village for these young people.